Good evening and welcome to our COVID-19 update. I am Ladi Akiridoluale. Here are the highlights at this hour. Resident doctors at the Ondo State University of Medical Sciences go on indefinite strike, say they will not resume until they have PPEs and hazard allowances. Oyo postpones school resumption by a week, says critical classes will resume first. And Brazilian court asks President Jair Bolsonaro to wear a face mask when in public as part of COVID-19 measures. Resident doctors at the Ondo State University of Medical Sciences have embarked on an indefinite strike following the non-payment of their salaries ranging from 3 to 6 months by the state government. The resident doctors, under the umbrella of the National Association of Resident Doctors, lament that they are being forced to down tools as government has failed to attend to them. The doctors had in May protested the non-payment of their salaries with a threat to embark on strike.
These are sights and sounds you would wish not this time. Health workers threatening to down tools over unpaid monies. For some months, doctors on training in Ondo State have been having a long-drawn battle with the management of the hospital and government over remunerations. Here are some of their grievances.
We want government and the management to clear all arrears. All arrears dated back to last year. Our May salary should also be paid, and January shortfall should be paid. It's unspeakable. It's not done anywhere where you give a medical doctor closed face mask to be simple. This is not a minimal guideline by NCDC. Concrete plan should be put in place for ensuring regularization of salary. This salary has not been regular. Do that. Number 4, we are asking for implementation of the COVID hazard allowance.
A sister association under the aegis of the National Association of Government General Medical and Dental Practitioners, still in Ondo State hospitals, are also going on strike indefinitely from tomorrow. Their grouse isn't as so much different from what their counterparts have.
For members who had been fighting and hoping to, with all their chests to contain COVID-19, unfortunately had their salaries reduced. And sincerely, the morale dropped. The special COVID allowance would have been a morale booster. It did not come. Salaries were supposed to be paid. It was paid. What happened to the salary? It dropped. Why? We found out. They said it was a 2.5% deduction of the basic salaries of all the civil servants in Ondo State. What was that for? They said it was for the National Housing Fund. Shockingly, no modalities were brought out. Our members were not informed.
Some ray of hope may be in the offing, as the doctors say they are always ready to return to work if government meet their legitimate demands.
In Kaduna State, the increasing number of cases and alarming levels of geographical spread raise grave worries about its future direction. However, before the advent of COVID-19, the state government had developed a response plan which takes into consideration and peculiarities epidemic-prone diseases like Lassa fever, measles, tuberculosis, and others. According to the Commissioner for Health in the state, Dr. Amina Balori, since the outbreak of COVID-19, the state has developed what it called a strategic preparedness and response plan for COVID-19, which aims to slow and stop transmission, prevent outbreaks, and delay spread. Dr. Balori says the integrated response plan will cover primary, secondary, and tertiary healthcare facilities where health workers will be able to respond swiftly to any emergencies.
The 90-day plan, as you know, has already been overtaken by events. We're developing the next 90-day plan, which looks at returning the focus back into our health sector. As you're aware, most of the resources were directed at looking at COVID for the first part of the pandemic. We realized that this cannot be sustained. And so we're looking at all our health system, including the primary health system, the secondary facilities, and the tertiary facilities, and looking at an integrated response where health workers will respond to the normal health challenges that we have, as well as integrate COVID response into it. For the medium term, we're looking at how we can strengthen those structures. So, for example, all our general hospitals, we're looking at putting isolation centers, which will serve COVID as well as other infectious diseases should they arise. And then we're looking at how to strengthen our structures in the long term. So we have disease notification and surveillance officers in each of the LGAs. We're building their capacity to feed the state with information from the grassroots, which will in turn guide our response. For the state, we realigned our budget. We've got a revised budget, and 27% of that budget is dedicated to health, which is an increase to what we had before. As you know, other development partners such as World Bank have provided grants. There is the CBN initiative on strengthening and the health system and making it resilient. All our development partners have realigned their budgets and their support to support COVID as well as other health system challenges.
Dr. Amina Baloni, the Commissioner for Health in Kaduna State, talking about the strategic preparedness and response plan for COVID-19. Students in what the Oyo State government calls critical classes will resume on the 6th of July in the state, while teachers will be back in school on the 29th of June. The Chief Press Secretary to the Oyo State Governor, Mr. Taiwo Adisas, who said this in a statement, asked students to expect to wear face masks while the schools are to prepare well-laid-out hand-washing spots to guarantee regular washing of hands by both students and teachers. Mr. Adisa says the State Task Force on COVID-19 will announce in July whether the other classes will be able to resume or wait to resume with the new session in September. The Oyo State government has tested close to 8,000 samples across 10 locations in the state for COVID-19. In Bayelsa State, as the number of persons that are coronavirus positive continues to increase, the state government says it intends to apply a more aggressive approach to curb the spread of the virus. Our correspondent, Deborah Timewood, is in Yenogwa and reports.
At the onset of COVID-19 in the country, Bayelsa State was one of the states that didn't experience a daily rise in the number of persons infected with the virus. But all that has changed now, as Bayelsa State has begun experiencing a daily increase in the number of persons infected with the coronavirus.
In the midterm, we want to ensure as much as possible that, we're able to, for everybody who took sample from, everybody who have listed as a contact, we want to be sure that we're able to cancel them. We're also able to get the results across to them as soon as it's possible and released. And then if there are things with specific counseling we need to do and specific treatment protocols we need to follow, we want to follow them through. In the long run, we want to ensure that people are better protected in the state. People are totally aware of what is happening. People can be their borders keepers, and our facilities are up and about. We have a laboratory in the state eventually that can have a massive capacity to test so many people in a day, so that immediately anybody falls sick, we're able to know what exactly is wrong with the person, and we're able to give definitive treatment, So all of those things are the things we are doing. And of course, we want to also ensure that our institutional memory, our doctors, nurses, and all of those health workers who have been part of this process continue to be updated in their knowledge, continue to have this high index of suspicion, and also critically and very importantly, we want to ensure that we maintain infection prevention control in our facilities. Recently, a lot of health workers have been getting infected. That is not acceptable. We want to put all of those measures to ensure that no health worker gets infected, and even if they do, they don't face their consequences from COVID-19. Those are all of those strategies and pathway and roadmaps were put together in the state.
Out of the 177 confirmed cases for coronavirus in Bayelsa State, there are 137 active cases, 29 persons have been discharged, and the state has experienced 11 deaths. From Yenegua, Dobra Timiwood for COVID-19 updates.
Nigeria at different times has had its fair share of outbreaks of epidemic-prone diseases such as measles, yellow fever, Lassa fever, cholera, and meningitis, amongst others. Health emergency responses such as these require well-coordinated approaches which would include disease surveillance, laboratory testing, emergency operations centers, and a well-trained workforce. Currently, there is a National Action Plan for Health Security 2018 to 2022, a multi-sectoral plan that integrates multiple work plans, including an NCDC strategy plan, as well as immunization plans. In the face of the COVID-19 pandemic, a National Health Sector COVID-19 Pandemic Response Action Plan is on its way to the National Council on Health for final adoption, at a special meeting of the Council expected to take place in the next 2 weeks. The expected outcome of the health plan is to control transmission, reduce morbidity and mortality, protect and care for vulnerable populations, foster stewardship and coordination of national health systems responses, engender innovative financing and operations, as well as a learning agenda. How well will this make a difference in curtailing the active community transmission of COVID-19 in Nigeria? And what more does the country need to put in place in terms of health emergency preparedness and response? Joining me in the studio via Skype from the Agbara area of Ogun State is the president of the Healthcare Providers Association of Nigeria, Dr. Adeyeye Arigbabuwo. Thank you very much for joining us, Doc. Good evening at this time. People would say that there are a lot of plans. There are many, many plans that have been put out, but that the problem is always with implementation. This particular plan that deals with COVID-19, do you see anything in it that suggests that the ends will be different?
Good evening, viewers. I think we have been very good planners all along. Our challenge has always been during implementation. And again, it's a paradox to say, for example, at this time, that we are thinking of cutting down on health budget when we are supposed to be pumping more into it. The issues concerning health cannot be politicized because no matter the sector we belong to, health is health. And if you are not well, if you are not healthy, you definitely cannot perform in any sector. Like we have put measures in place, yes, for people to follow the guidelines of NCDC, we need to do some enforcement, despite the fact that we are recording very high figures as it were now. We still can see that education is actually what we need, because most of these things we are passing through are really novel. And our socio-cultural attitude, they also matter. In this situation, we talk of the schools opening, we talk of the churches opening, we talk of opening up the economy. But how can we open the economy completely when the people are dying? So what we need to do first is education. We keep on educating. We keep on talking and communicating. We do not need to give up because it is novel. Outside this, the budget performance, budget appropriation, and the performance that will normally match together. You look at it in 2001, in Abuja Accord, we said 15% of the budget should go for health. Now we've been hovering between 3.5 to 5 or to 6%. Despite all this, our performances in budget have been abysmally low. We have any reason again to cut down about 40% of the budget allocation to health, as it were. Our target of fighting COVID-19 might just be like daydreaming. One can understand that there are many other sectors competing for this same budget, but we need to know one thing for sure, that health is not comparable to any other sector. until we invest in our health and until we know that we cannot politicize budgetary allocation to health, then we're not really getting at our proposed target. What we need to do
Doctor,
as
sorry, Doc, allow me to please interrupt you at this point. Let me draw your attention to the plan. I know you talked about the budget and the fact that it's being cut, but my initial question had to do with this plan, the strategic preparedness and response plan. Is it adequate for what we're dealing with, particularly COVID-19? You've talked about the fact that people need to be better educated and all that. Is that covered by this plan from what you know?
Thank you. What I think we lack now is believing, our people believing that even COVID-19 exists and is a reality. Plans are there ahead for our people to comply with. Our challenge now is compliance. And if we want to do enforcement concerning these plans, when we look at the guidelines put in place, they are, I will say to the best of my understanding, they are adequate. But compliance and implementation are the challenges we have. Imagine people putting on face masks only as if to say you need to do that at security checkpoints. As soon as they veer away from the security checkpoints, it is either you see the face mask under the chin or somebody throws it off. So this again, and there's issue of social distancing. How much of it do we understand in marketplaces? How much of it do we even understand at the various communities where we find ourselves? The challenge we have has to do with community infection as it is today. The plans we have that are strategic is, okay, look, social distancing, this is the time for school to resume, use your face mask, wash your hands as it is, as much as possible, use sanitizer. If these plans, they look fine and beautiful. Are we able to enforce? How do we behave when we get to the bank? How do we behave when we get to the marketplace? How are we expecting our children and students also to behave even if they go back to school? How do churches behave and followers in the church behave and the mosque and other worship places? So no matter how beautiful what we have on ground is in terms of these strategic plans, implementation still remains the hallmark of our challenge.
Now, finally, before we end this, let me ask you about funding, because all of this, you alluded to it earlier when you talked about the budget and budget performance and how much we get by way of releases. Are there other ways that funding can be provided for some of these things that you've mentioned that need to be done for the health sector at this time?
Yes, even at the beginning of the lockdown, we saw some corporate organizations coming up with corporate social responsibility, making donations, philanthropists coming up to do one thing or the other. We've enjoyed all of this both within the country and even from outside the country, even from NGOs and other countries who appear wealthier and can be bigger brothers. Yes, as of today, we need to do community mobilization. Talk to our philanthropists. Some animals, we say all animals are equal, some are still more equal than the others. There are some bigger brothers out there who are philanthropists. Some can even donate their places, like structures, for example, for us to use as a isolation center. And apart from the people who are still donating beds, they are donating materials. We want and we need more testing materials. We could use all the monies of all the philanthropy we've been doing, even our politicians, our lawmakers who are doing constituency allowances. Some of these monies in their care, for example, can be pumped much more into reviving our people and especially taking care of those who are actively taking treatment for COVID-19. The challenges and the cost of managing the average COVID-19 patient can be quite enormous, especially those with intensive care. And I believe that we can still approach more of the NGOs. We can talk to philanthropists. We can even talk to people who used to do adoption trip for us on health insurance before and find a way out that we can pull these resources together in one basket and make our governors for the various states, even our Minister of Health, for example, to engage our governors through the Governors Forum, for example, to pull these resources in a common basket and target COVID-19.
Thank you very much. Thank you very much, Dr. Adeyeye Arigbabuwo, for that. Thank you for joining us at this time. on our COVID-19 update. It's been a pleasure having you with us. Dr. Aribabu joined us first cap from the Abara area of Ogun State. We'll take a break. When we come back, we'll bring you the very latest in the figures, the stats for COVID-19 as of now. Please stay on with us. Welcome back. Thanks for staying tuned to our COVID-19 update. As at the close of June the 15th, 2020, that's just about a week ago, Nigeria had recorded 424 COVID-19 deaths. Today, the death toll stands at 525. This shows that in the space of 1 week, over 100 persons have died as a result of the virus across the country. Figures from the NCDC put the number of coronavirus cases at 20,919, with a total of 7,109 COVID-19 patients recovering from the disease. 675 new cases were announced by the NCDC, the latest infections in 21 states. Take a look at the regional breakdown and you'll see Lagos State in the southwest is on top with 8,864 cases, followed by the FCT with 1,583 and Kano in the northwest with 1,190 cases. These are also the top 3 states with the highest COVID-19 cases in the country. Oyo State and River State follow in 4th and 5th places in the top 5 states. River State leads in the south-south region with 930 cases. Borno still tops in the northeast with 476 cases, and Ebonyi in the southeast with 264 cases. Now, Benue State has recorded its first COVID-19 death as the confirmed cases in that state rise to 47 from the initial figure of 39 just this weekend. The Commissioner for Health and Human Services, Dr. Sunday Ongbabo, who could not categorically confirm the cause of death, explains that the victim was being managed for other health complications arising from a surgery he had, but a post-mortem test conducted on the corpse came back positive for COVID-19. Of the 47 confirmed cases, there are 32 active cases. 13 persons have been discharged with 1 death, which we've just talked about, and 1 case was transferred out of the state. To further look at Nigeria's health emergency preparedness and response capacity or plan, against the background that we've had all evening, is our regular public health physician, who is also a senior lecturer at the College of Medicine, University of Lagos, Dr. Alera Roberts. Dr. Roberts, thank you for coming in.
Thank you for having me, and nice to see you back on your seat.
Thank you. Nice to be back. First, this strategy or plan, do you think, given what we've experienced so far for over the last 4 or so months that we've been battling this particular pandemic, is a step in the right direction?
First of all, the plan isn't exactly new. This was a plan that was launched in 2018, and it served to beef up the basic health care, was going to be serving the basic health care plan, strategic plan, and the basic healthcare fund. So the problem has always been implementation, and this is it. I mean, the hoops and loops that states have to jump through in order to access the money, how to make it accountable, how to make it transparent in the backdrop of what operates in our milieu anyway, is what has made it a little unwieldy, perhaps. I mean, only 6 states have been able to access the fund out of 36 states and the FCT in the past 2 years. So this speaks to me about how well we're doing as per performing budget performance, how well we're doing in terms of supporting the health system and growing it and strengthening it. So there are many issues, but I kind of like my job.
Now, there are many institutions. You alluded to that just now, that it appears unwieldy, but could that be because there are many institutions at various levels? Because health is on the concurrent list. So the federal is legislating, the state is legislating, in some cases the local governments too are also involved in this. Could that be part of the problem? Would it be better if, for example, we had something like the PTF, which was guiding that kind of plan? I just use them though.
I know. But a lot of the problems that we have here are the duplication of agencies, duplication of efforts, duplication of roles and responsibilities across many agencies. So you have something like primary health care in its entirety as what was described, all those years ago. And it's being handled you know, you've got to have the input of agriculture, you've got to have the input of works and housing, you've got to have the input of education, you've got to have the input of health, you've got to have the input of finance. And everybody, women's affairs, everything, youth, sports and development, all these agencies, ministries, departments have to have some input in making primary health care come to pass. So by the time you're doing that and you've got a reduplication of roles and responsibilities, it makes things a little unwieldy. Suddenly, either everybody is doing one thing and then there are things falling in between the cracks. And this is simply what is happening again now. We keep talking about the funding, which is critical and crucial. And then funding has to go for training, funding has to go for retraining, funding has to go for retention, funding has to go for recruitment, funding has to go for repairs, renovation, funding has to go for capital projects. Then you've got the people who are retiring and funding has to go into the retirement benefits as well. So you've got situations like what you just reported in the Ondo state, state, with the doctors going on strike for not having been paid 3 to 6 months. Now, if the doctors are out there complaining, does that mean that they've paid the nurses, the pharmacists, the physiotherapists? Just because they are keeping quiet doesn't mean that they've been paid. So these are the issues that really make this thing. And I think what everybody's a little tired of, frankly, Ladi, is this situation of continuing to do the same thing and then expecting a different outcome. Madness.
We are not, we are going to, or we are having, and will continue to have problems of personnel. You did mention now the Ondo State example. Some of what I read, what I read up over the weekend tends to suggest that, yes, even though there's a particular number that is ascribed as being the number of doctors that we have, about half are practicing outside the country.
Absolutely.
So in reality, we have about half the number in the country.
A third.
Or about a third. Okay, fine, because there are some who are unexplained.
Two-thirds are outside the country.
Which means that we're not producing enough to replace those who've left.
But funnily enough, numbers-wise, we're producing more than enough to satisfy the needs of this country.
But we seem to be producing them and they're just leaving.
And they're just leaving. I mean, I can assure you right now that the present crop of new, about to graduate medical students that we have are standing there with their tickets in hands. You just open the airport today, and by next week they'll be gone. And they have jobs. Because we are producing to a very high level. They pass these licensing exams like that. And these are the issues. Now, we keep saying doctors, doctors, doctors. Every time we say doctors, please add nurses, add physiotherapists, add pharmacists.
Who are all leaving as well.
Who are all leaving. Because we train to a very high level. And our scientists, all of them. And the government is sitting down there saying that, oh, if the doctors go on strike, we're going to sack you all. Who's going to do the work? Now we've got these numbers jumping up. I mean, over 100 people in a week died of COVID. It hasn't counted the number of people that have died
of other things.
Of causes yet unknown.
Okay.
That could be ascribed to COVID. Because COVID adds its own weight to whatever underlying problem you may have. So like the chap, the Minister of Health in Benue just said, the cops tested positive and clearly had some part to play in the eventual death of the man. This is happening all over the country. Who's going to do the work?
So all this, in spite of all the plans, and the last guest talked about slashing all this going on at about the same time, the health budget is being slashed by about 40%. Now, from what you've said, that may not really have mattered if all along we had been doing more or less the right thing.
Exactly.
But then that brings us to where we are now. It seems as if we're facing COVID, maybe not altogether successfully, but we're letting other things slip through the cracks.
We're letting huge things slip through the cracks. And it's beginning to look almost as if we're using COVID as an excuse not to face the underlying things. Because we would be able to deal with COVID. We had Dr. Odubanjo on last night, and I listened to him. And we would have been able to deal with this COVID if we had had our integrated disease surveillance and response working as it ought to work. And it's not rocket science. This thing has been done in smaller countries around the world, other countries in the low and middle income country bracket, so to speak. So we're not talking about, oh, if we're not America, we're not the UK, we are not. But smaller countries with a lot less in terms of resources have been able to do this and do this successfully. There is a recipe, so to speak, and it works. Why don't we just follow it?
But in that case, why do you think we're not able to follow it? Maybe I should ask that.
That's the good question. He mentioned yesterday, and it's very true. What we have is a situation where we have things in silos. So we're chasing COVID, and everything is relating to COVID, and the doctors are not getting PPE, and they're not getting their payment. Then we're chasing Lassa fever. Lassa fever, by the way, more people have died from Lassa fever between January and now than in the same period of time last year. So we're having, that one is...
That is also going on side by side.
on and is getting out of control. You understand? We still have all the other vaccine-preventable diseases that we're trying to battle in children. Right now, with the airports locked, how are we even getting vaccines into the country and getting them distributed to others? So we have seen a huge downturn in the number of women taking their children for immunization, the number of women going for antenatal care, which means that we're going to have a huge number of women coming into delivery with preventable problems that are going to cause problems. And now the doctors and the nurses. So, you know, we've got this issue where we are siloizing all our health problems, thinking that, and everybody now wants to, you know, trip over everybody's ego and make out that theirs is the most important thing to deal with. No, it is the health system. And as I've said here on the program before, the health system is like the human body. Everything has to work together in synchrony for it to work, for it to answer the needs of the country.
Going forward then, that leaves a basic question. Each time you've come here, I've learned from what you say that everything we talk about at the top or near the top will still devolve down to the primary healthcare level.
Absolutely.
And at that level, we don't appear to also be focusing any attention right now. That's getting lost in all the isolation centers, the quarantine, the case management and all that. Nobody's talking about those anymore.
Because primary healthcare has never been the sexy one. That's the truth of the matter. With your health on the concurrent list, you've got primary health care being handled at local government level. You've got secondary care being handled at state level. And then only the tertiary care being handled at federal level. And now that's the really sexy one. That's the one where you get to go abroad and look at the MRI machines and bring them back and have all the photo ops and the white ribbon cutting. The very basic grassroots level, which is the primary healthcare level, which is where this thing should have started in the first place, which is where IDSR takes place, which is where the health promoters, the health educators are working very hard in the community and flagging these things up. That's where our attention ought to have been. Because, you see, you have an epidemic. At the end of the day, it's not the DG and CDC, much as I love him very much, it's not the DG and CDC who's going to be able to say that's an epidemic going on. It's a very eagle-eyed health promoter, health educator, community health extension worker, community health officer, who is going to say, we've seen 1, 2, 3, 10 cases of this in this place, and raise a finger and say, come, something is going on here. That's where IDSR needs to work. And this is an integrated system, which means that everybody has to come on board. Everybody has to be trained. Everybody has to be working to the same goal. It's not sexy, but it's so important.
And paradoxically, it's at that level that
you've got you've got most people living there, and you've got the weakest arm of government in charge.
Dr. Roberts, again, as I say, whenever you come here, plenty of food for thought, plenty of things to chew. Thank you so much for your time on the program.
Thank you so much for having me. We will solve this. We will get to the other side of this.
By God's grace. Top U.S. infectious disease expert Dr. Anthony Fauci has testified before Congress that the country, that is the United States, will be doing more COVID-19 testing, not less, hours after President Donald Trump insisted he was serious when he called for testing to slow down in the United States. Infections have risen in 29 states, with several breaking their daily records, but life and politics continues in America. Our Washington correspondent, Maria Bird, has more.
Coronavirus cases continue to escalate across the United States, but it is clear that voting is still underway, despite many mishaps.
Our first obligation is to reduce the number of voters who will cast their ballots in person on Election Day through national access to vote by mail. All states have the current capacity. However, we must remove unnecessary barriers to participation and scale infrastructure to allow widespread use of the safe, tested, and auditable method of balloting.
While the U.S. has seen over 2.3 million cases and over 120,000 deaths from the coronavirus, the U.S. is preparing for a U.S. presidential race, and voting is critical. Despite the spike of cases in several U.S. states, President Trump still held his campaign rally in an arena where he made several comments related to the coronavirus.
And despite the fact that I have done a phenomenal job with it, I shut down the United States to very heavily infected, but all people from China in late January, which is months earlier than other people would have done it if they would have done it at all. I saved hundreds of thousands of lives. We don't ever get even a mention.
The coronavirus has not stopped voters from going out to the polls as they are hopeful that the White House and many other offices will see change in the near future. From Washington, Maria Bird, Channel Television News.
We'll take a break at this point. When we come back, we'll take a look at what's happening in other climes with COVID-19. Thanks for staying tuned. Let's speak to Maria Bird now about her reporting. Good evening, Maria. Thank you for your time.
Good evening. Thank you for having me.
It looks like in spite of COVID-19, the politics is in full swing ahead of the November elections. What are the health preparations like for that?
Well, the health preparations are, continuing to focus on the social distancing, the masking, trying to find ways and solutions to be able to address people when they contract the COVID-19 actual infection. And so that's the real push because, again, we know that a vaccine was supposed to be slated to be ready by January, but I don't know if that is really going to reach the mark that they were hopeful for. And again, the world is continuing to move, and the country specifically is continuing to move. As we know, just like the campaign rally, 6 of the members, and actually they found 8 in total of the members of the president's campaign committee were tested positive for COVID-19 once they reached Tulsa, Oklahoma. So the fact that the cases will escalate and continue to grow is something I think we can't avoid until a vaccine is actually secured. And so it's really about making sure that people are using the masking and social distancing and trying to avoid another government shutdown.
Earlier on, in previous reporting of yours, you had talked about fears that some of the top scientists and others did have about the possibility of a second wave of infections. Now, in your reporting, you talked about a rise in infections in 29 of the 50 states already. Florida, for example, has broken its daily record. Are we headed in that direction now?
We are. And there was just a breaking news report here in the U.S. a few hours ago stating that there are, in many of the states, except for, unfortunately, New York, and states that were heavily impacted early on, are not showing those type of rises. But you talk about Arizona, you said Florida, Texas is another state that is rapidly getting to a place where they could foresee record numbers. And so we're really looking at some real heavy spikes in a time where people were hopeful that would reduce because we're in the warm season here in the U.S. and we all know that COVID-19 is not supposed to be able to survive the hot seasons. And so this is really making many scientists a bit concerned. And we're looking at potentially close to 200,000 deaths by October if we start to see these spikes across the country, even further than 22 states that have already seen spikes.
Yet President Trump talks about the fact that he wants less testing. He wants the testing to slow down, not rise.
Again, unfortunately, we all know that the president and his cabinet and those close to him are getting tested daily. And so how can we want to reduce the number of testing when he and his immediate staff are being tested on a regular basis? We know that COVID-19 has impacted communities where people have underlying conditions at a disproportionate rate. And so that would definitely put so many people at risk. We've seen entertainers that are out on tour that have passed out not knowing they had COVID-19 and then finding out after they're not feeling well they have this infection. So again, I think that that is really not focusing on the real issues that we need to address and allowing the politics to take the precedence.
Do you think that the COVID-19 pandemic, of course, will have an impact on November's election, both as an issue and because it will have impact on how the voting is conducted? But are there any preparations being made for that?
Yes, so most of the polling stations are finding ways to have 6 feet distance. But again, mail-in ballots are the way that some states are going. Oregon is the one state in the United States has been doing mail-in ballots prior to COVID-19. So people are trying to model their system. But we know that there could be devastation and disaster as far as the voting process, because people might either decide not to go out to vote or do the mail-in ballots. And how will they be able to calculate all of those ballots in a timely manner when that has not been traditionally the way in which people have voted in the U.S. And so it's a very interesting time. We're noticing people are in longer lines than normal, having to wait for hours on end because of the social distancing measures, having to wear masks, obviously, when they go to vote. And so this will definitely create a major challenge come November. But again, Americans are hopeful and they're trying to be resilient as possible despite this COVID-19 epidemic.
Thank you very much, Maria Bird from Washington this evening, and do continue to stay safe out there.
Thank you.
Elsewhere, the Brazilian president, Jair Bolsonaro, has been ordered by a judge in the country to wear a protective mask on his face when in public and in the surrounding federal district. President Bolsonaro had been highly criticized for belittling the risk posed by the coronavirus. The country has the second highest number of COVID-19 cases and COVID-19 related deaths in the world after the United States. Meanwhile, 2 districts in Germany have reimposed lockdowns following a spike in the number of COVID-19 cases.
In Germany, authorities are reinstating local lockdown measures in North Rhine-Westphalia following an outbreak in a meat packing plant, with 1,553 workers testing positive for the coronavirus. This is the country's largest outbreak since lifting its lockdown in May. Germany currently has a total of 192,127 cases, with a death toll of 8,909.
Listen, good luck tomorrow. Are you ready? Are you braced?
In the United Kingdom, Prime Minister Boris Johnson is expected to announce pubs, cinemas and galleries to officially reopen from July 4. Ministers are still considering having customers register when entering pubs and bars, so they can easily be tracked down if they come into contact with an infected person. The UK has recorded 306,761 cases and a death toll of 42,731. Over in the United States, the death toll has surpassed 120,000, while the total cases tops 2.3 million. New infections have been spiking in several U.S. states, with Florida being the 7th state to reach the 100,000 case mark. Florida has encouraged citizens to wear face masks, while Texas fears it could be forced to close again. In the Middle East, Saudi Arabia says it will allow roughly 1,000 residents of the region to participate in the Islamic pilgrimage known as Hajj this year in an attempt to curb the spread of the coronavirus. An estimated 2 million people would have normally visited Mecca otherwise, and many feared it will be cancelled altogether. In South Africa, about 180 students have tested positive for the coronavirus after the country began reopening schools. Officials say contact tracing and testing is underway after a school in the Eastern Cape region has been closed for decontamination. The South African Democratic Teachers Union has called for the closure of schools in the area, with more than 300 fatalities in the region. The neighboring Western Cape province has recorded 1,500 out of the country's 1,990 total deaths.
If you develop common symptoms of COVID-19 like fever, cough, or sudden loss of taste or smell, please take responsibility. That's the message from the Nigeria Center for Disease Control, the NCDC. The agency's website has information on states' hotlines that you can call for further advice. For global information on COVID-19, log on to the World Health Organization website. The body's page guides the public health response at national and subnational levels. Our website, channelstv.com, has more updates. You can also find the latest on the pandemic in Nigeria and across the world plus other stories. Thank you for watching tonight. I am Ladi Akeridoluale. Good night.